Bit of tiredness here, a little shortness of breath there. You tell yourself it's just age or stress or maybe the weather. You take a break, rest a little, and feel better, for now. But deep down something feels different. The small things that never used to bother you now seem harder. Climbing stairs takes your breath away. Walking to the gate feels like a workout. You wake up at night trying to catch your breath, wondering why you suddenly feel so uneasy. For many seniors, this is how it begins. Not with a dramatic collapse, but with a whisper. The heart doesn't stop all at once. It struggles quietly, sending small, gentle warnings that something isn't quite right. And too often, those signs are ignored. That's why understanding them early can make all the difference between living freely and facing a sudden emergency. Today, we're going to talk about 12 early signs of heart failure every senior should know. These aren't random aches or harmless tired spells. They're signals from your body asking for help. If you pay attention and act early, you can protect your heart, improve your quality of life, and maybe even save your own life. Now, before we begin, let's take a moment to understand what heart failure really means. The term heart failure sounds frightening, but it doesn't mean your heart has stopped. It means your heart isn't pumping blood as efficiently as it should. When that happens, blood and fluid can back up into your lungs, and your body doesn't get enough oxygen. This makes even simple daily tasks harder: walking, eating, or even breathing. But here's the truth. With the right treatment, many people live long, active lives even after being diagnosed with heart failure. Awareness is the first step. Let's start with the first early warning sign: unusual fatigue. If you feel drained all the time, not just a little tired, but deeply worn out, it could be your heart. You might find yourself unable to finish chores that were easy before. You rest more, but it doesn't seem to help. This kind of fatigue happens because your heart is struggling to deliver enough oxygen-rich blood to your muscles and organs. It's like your body is running on low battery. Many seniors dismiss this, thinking it's just part of getting older, but it's one of the most common and overlooked signs of heart failure. Now let's move to the next one: shortness of breath. Maybe you notice it while climbing stairs or doing light housework. Maybe it comes even when you're sitting or lying flat. You might wake up suddenly at night gasping for air, needing to sit up just to breathe. This happens because fluid can accumulate in the lungs when your heart doesn't pump effectively. It can make you feel anxious or restless, especially at night. If breathing becomes noticeably harder without an obvious reason, it's time to pay attention. Our next sign is swelling, especially in your ankles, feet, legs, or even your abdomen. This swelling, known as edema, happens because your blood isn't circulating properly and fluid begins to pool in your tissues. You might notice your shoes fitting tighter or your socks leaving deeper marks around your ankles. Some people also feel bloated or heavy in their midsection. It might not hurt, but it's a visible warning from your body that your heart is struggling to keep up. Now let's talk about sudden weight gain. You step on the scale and notice you've gained 2 or 3 pounds overnight, even though your diet hasn't changed. Or maybe 5 pounds over a few days. This rapid increase isn't from fat, it's from fluid building up inside your body. When your heart isn't pumping well, your kidneys retain salt and water. This silent weight gain is one of the strongest early signs of worsening heart function. If you see this kind of sudden change, it's important to tell your doctor right away. Next comes something many people mistake for a simple cough or allergy: a persistent cough or wheezing that just won't go away. You might notice the cough getting worse when you lie down or at night. Some people even cough up a frothy or pinkish fluid. That's because fluid is backing up into your lungs. It's not always painful, but it's a serious indicator that your heart needs help. If your cough lingers for weeks and doesn't respond to usual medicine, it's time for a medical check. Now let's move to something more subtle: loss of appetite or a feeling of nausea. You might not feel like eating, or you may feel full after just a few bites. This happens because when your heart isn't working properly, blood flow to your digestive organs decreases. Your stomach and intestines can't work efficiently, leading to bloating, loss of taste, or an unsettled stomach. If you've noticed your clothes fitting looser or you're losing weight without trying, it's worth paying attention. Another sign that often appears as the condition progresses is increased nighttime urination. You might find yourself getting up several times during the night to use the bathroom, even when you haven't had much to drink. Here's why: during the day, fluid tends to collect in your legs and feet. When you lie down at night, That fluid moves back into your bloodstream and your kidneys work harder to eliminate it. While this can have other causes, if it happens along with swelling or shortness of breath, it could be related to heart failure. Now let's talk about something that might surprise you: confusion or difficulty concentrating. Maybe you've noticed moments of forgetfulness, or your thoughts feel foggy and slow. You might misplace things more often, or have trouble focusing on simple tasks. This can happen because your brain isn't getting enough oxygen and nutrients from your blood. It's not just about memory, it's about circulation. Sometimes, family members notice this before the person does, so if someone close to you points it out, take it seriously. Next is a rapid or irregular heartbeat. You might feel your heart pounding in your chest, fluttering, or skipping beats even when you're resting. It can feel unsettling, especially when it happens suddenly. This occurs because your heart is working harder to meet your body's needs. Irregular rhythms can be harmless at times, but in the context of other symptoms, they can indicate that your heart muscle is under stress. If you ever experience strong palpitations that come with dizziness or chest discomfort, seek help immediately. Now, another major warning sign: chest pain or pressure. Some describe it as a squeezing, heaviness, or burning sensation. Others feel it spreading to the neck, shoulders, or arms. Chest pain doesn't always mean a heart attack, but it should never be ignored. Even mild, occasional pressure can be a sign of poor blood flow or blocked arteries. If it comes along with sweating, nausea, or breathlessness, it's a medical emergency. Always err on the side of caution. Let's move to another important sign: changes in your skin temperature or color. You might notice that your hands, feet, or toes feel unusually cold, pale, or even slightly bluish. When your heart can't pump enough blood to your extremities, your body prioritizes vital organs like your brain and heart. This reduced circulation can make your skin clammy or cool to the touch. It might not cause pain, but it's a visual clue that your blood flow isn't where it should be. And now, the 12th sign: dizziness or fainting. You may feel lightheaded when standing up or moving quickly. Sometimes, you might feel like you're about to black out. This happens when there's not enough blood reaching your brain, or when your heart suddenly changes rhythm. Fainting is a serious symptom, especially if it happens more than once. It can be dangerous if it occurs while walking or driving. Never ignore spells of dizziness or unexplained fainting. Your body is giving you one of its loudest warnings. If you've recognized one or more of these symptoms in yourself or someone close to you, don't panic, but don't ignore them either. Heart failure doesn't develop overnight, and when caught early, it can be managed successfully. The key is paying attention to your body and acting quickly. Start by writing down the symptoms you've noticed, when they appear, what seems to trigger them, and how long they last. This helps your doctor see patterns that can point to the real cause. A simple visit to your doctor could include tests like a chest X-ray, an electrocardiogram, or an echocardiogram, all of which can give a clear picture of how your heart is functioning. None of these are painful, and they can reveal problems long before they become emergencies. In many cases, early diagnosis and simple lifestyle changes can dramatically slow or even stop the progression of heart failure. Now, let's talk about what you can do today to protect your heart and ease its workload. One of the most effective steps is keeping an eye on your weight. We mentioned sudden weight gain earlier. That's because fluid retention can change quickly. Try to weigh yourself at the same time each morning after using the bathroom and before breakfast. If you gain more than 2 or 3 pounds in a day or 5 pounds in a week, call your healthcare provider. Early reporting prevents serious complications. The next step is managing salt intake. Salt makes your body hold onto water, increasing the strain on your heart. Start by tasting your food before reaching for the salt shaker. Read labels when buying packaged food. You'll be surprised how much sodium hides in everyday items like bread, canned soup, and sauces. Use herbs, lemon, or garlic instead for flavor. These small adjustments add up to big differences over time. Stay physically active, even if it's just gentle movement. A slow daily walk, a bit of stretching, or light household chores all help keep your blood flowing and your muscles strong. If you haven't been active for a while, talk to your doctor before starting. They can guide you on a safe plan that fits your condition. Remember, movement is medicine for the heart. Also, take your medications exactly as prescribed. Heart medicines only work if taken consistently. Set reminders on your phone, or keep a small notebook by your bedside to track doses. Never stop or change your medication without talking to your doctor first, even if you feel better. Your doctor can adjust your plan safely if needed. And just as importantly, manage stress. Emotional strain raises blood pressure and heart rate. Try deep breathing, gentle music, prayer, or spending quiet time in nature. Stay connected with loved ones. Loneliness can harm both the heart and the mind. Talking about how you feel isn't a weakness. It's one of the strongest things you can do for your health. Many seniors who learn to manage heart failure successfully share one thing in common. They listen. They listen to their bodies. They notice the small changes, they ask questions, and they never feel ashamed to seek help. You deserve the same care and attention. You've spent your life caring for others. Now it's time to care for yourself. Let's take a moment to think about what's at stake. The heart beats around 100,000 times every day. It never rests. It works for you through every season, every joy, every challenge. When it asks for help, even through the smallest symptom, it deserves to be heard. Don't wait for pain to become unbearable or fatigue to become disabling. Every heartbeat is a message of life, and your attention can keep it strong. Sometimes, people hesitate to see a doctor because they fear what they might hear. But knowing is far better than guessing. Knowledge gives you control. Early diagnosis gives you options, treatments, therapies, and changes that can make a real difference. Heart failure may sound final, but it isn't. With care, people live for many years, traveling, laughing, and making memories. Life doesn't stop. It just requires a bit more mindfulness. Now, let's summarize the 12 early signs one more time, not as a list to memorize, but as clues to remember. Persistent tiredness that doesn't improve with rest. Shortness of breath during activity or while lying down. Swelling in the feet, ankles, legs, or abdomen. Sudden, unexplained weight gain. A lingering cough or wheezing. Loss of appetite or constant nausea. Increased nighttime urination. Confusion or memory lapses. Rapid or irregular heartbeat. Chest pain or pressure. Cold or clammy skin. And dizziness or fainting spells. Even one of these might be harmless on its own. But when two or more appear together, it's a clear signal your heart needs attention. These signs are your body's built-in alarm system. Gentle, but persistent. Listening to them can change everything. So, what should you do next? First, make an appointment with your healthcare provider, even if you're not sure what's going on. Second, share your symptoms honestly. Don't minimize them or say, "It's nothing." Your doctor can only help if they know what you're feeling. Third, take your loved ones with you if you need support. Two sets of ears often hear more than one. And if you've already been diagnosed with heart failure, remember that's not the end of the road. It's the beginning of a new chapter, one where knowledge, care, and routine become your strongest allies. Follow your treatment plan, stay active, eat wisely, and monitor how you feel day by day. Most importantly, believe that improvement is possible. The heart is resilient. With care and determination, it can regain strength. Now, let's talk briefly about hope. Medicine has advanced tremendously. There are medications, devices, and lifestyle therapies today that weren't available just a few years ago. Doctors now understand how to manage heart failure far better, helping patients live longer and with fewer symptoms. But none of that helps if the warning signs are ignored. You are your own first line of defense. Think of your body as a trusted friend. It doesn't hide the truth. It whispers it. The fatigue, the swelling, the breathlessness, they're all gentle nudges to remind you that your heart needs kindness and attention. You don't have to face that message with fear. Face it with gratitude that you noticed, that you can act, that you still have time to protect what matters. And if you're watching this not for yourself but for someone you love, don't wait to have the conversation. Talk to them about these signs. Sometimes, seniors downplay their symptoms because they don't want to worry their family. But caring means speaking up. A simple chat can lead to an early diagnosis and years of better health. Before we close, let's end on a note of encouragement. You've made it through challenges, changes, and seasons of life. You've adapted, persevered, and grown stronger each time. This, too, is something you can manage. Your heart has carried you through everything so far, and with the right care, it will keep carrying you for years to come. If this message has helped you, please share it. Someone else might be experiencing these same warning signs without realizing what they mean. You could be the reason they see a doctor in time. And if you haven't already, subscribe to Senior Health Affairs and turn on the notification bell. Every week, we bring you clear, compassionate, science-based advice to help you stay informed, independent, and healthy. Because your health isn't just about living longer, it's about living better. Every day you learn, every step you take toward awareness, every small habit you change, adds strength to your heart and years to your life. So take a deep breath right now. Feel that heartbeat in your chest. That's your reminder. You're still here, still capable, still in control. Protect that rhythm, cherish it, and listen to what it's telling you. This is Senior Health Affairs, wishing you peace, strength, and good health. Take care of your heart, and it will take care of you.